You know, there is this really fascinating and honestly kind of terrifying contrast in the world of modern wellness right now.
Oh, totally. It's a massive disconnect.
Right. Like, on one hand, you have this glossy marketing promise, and I'm literally quoting directly from their promotional material here. Oh my God, orgasms.
Yeah, that's the pitch. And then on the other hand, you have the actual reality.
Which is a stark, sterile $800,000 medical malpractice lawsuit.
Exactly. You've got a patient walking into this beautifully lit
Yep.
clinic, right? And they're expecting like a literal miracle cure for intimacy issues.
But instead, they end up sitting in a downtown San Diego courtroom.
Yeah, just detailing the absolute destruction of their physical and emotional life.
It's wild. Welcome to the deep dive, everyone. We're so thrilled you're joining us today.
So glad to have you here.
Because our mission for this conversation is to figure out exactly how a patient gets from that glossy promise to that courtroom reality. Like, we are exploring the ethical guardrails of informed consent.
Or, I mean, the total lack of those guardrails in some of these cases.
Exactly. What ethical standards are actually supposed to protect you against exaggerated claims of, instant orgasmic transformation?
Right, because we are looking at what happens when patients are sold these innovative, totally unproven treatments.
Specifically focusing on this highly controversial procedure known in the wellness industry as the O shot.
Yeah, and to really map out how the marketing overrides the medical reality here, we're pulling together some incredible source material for you.
We've got a really great stack today.
We really do. We're looking at this granular, day-by-day courtroom reporting from the Times of San Diego, but we are also analyzing the actual physical consent forms that these real medical spas make their patients sign.
The fine print on those is just unbelievable.
It's staggering. And to understand the rules these clinics are supposed to be playing by, we'll be breaking down FTC and FDA advertising guidelines.
Along with the really rigorous ethical frameworks from the American College of Physicians and the AMA.
Exactly, the foundational rules of medicine.
Okay, let's unpack this because, we really cannot talk about the ethics of informed consent in the abstract.
No, it doesn't make sense unless you look at real life.
Right. If we want to understand how these standards protect patients, we need to ground this in reality by looking at what happens when basically every single one of those protections just entirely fails.
Yeah, when the system completely breaks down.
So I am going to hand it over to you to set the stage. Walk us through this actual harrowing case that brought all these ethical questions crashing into that San Diego courtroom.
Yeah, okay. So to really understand this failure of informed consent, I want you to picture, like, a literal worst-case scenario.
Okay, painting the picture.
Right, and this isn't a traditional hospital setting we're talking about. This is a glossy medical spa in San Diego. Out in the waiting room, it looks like a high-end salon.
Very aesthetic, very calming.
Exactly. But inside the actual treatment room, the medical standards were just dangerously chaotic.
Well,
Yeah. So the case centers around a woman named Chamia Herway. Back in 2021, she was a 32-year-old spa esthetician working at B Medical Spa and Wellness Center.
she actually worked there.
She did. And the medical director there, Dr. Nadine Haddad, had just been certified to offer this new procedure called the O shot.
Okay, wait, before we get into what happened in that room, let's quickly establish exactly what the O shot actually is.
Yeah, that's crucial.
Because, the underlying biology here is really important to understand the massive leap of faith these clinics are asking patients to take.
For sure. So the O shot is basically a branded application of platelet-rich plasma, or PRP, therapy.
All right.
What happens is the provider draws a vial of the patient's own blood, and then they spin it down in a centrifuge.
Right, to separate the components?
Exactly. The goal of spinning it is to separate the red blood cells from the plasma, so you isolate this highly concentrated serum of platelets.
And the theory is, and I know this is heavily utilized in sports medicine, right? Like for torn tendons or joint repair.
Yes, exactly. Sports doctors use it all the time. The theory is that platelets contain these growth factors, and those growth factors are supposed to signal your body's stem cells to rush to the area, increase blood flow, and basically rejuvenate the tissue.
So they use this to heal like a pitcher's elbow, but in the case of the O shot, they're applying that exact same logic to sexual wellness.
Yeah, and that is a massive leap.
Logically, I guess I see the connection they're trying to make, but...
Right, but the application is intense. The provider takes that concentrated plasma and injects it directly into the patient's clitoris and the anterior vaginal wall.
Oh, man.
Yeah, The marketing claim is that those same growth factors will rejuvenate the vaginal tissue, dramatically increase sensitivity, and just fundamentally improve sex drive.
I mean, taking a needle to one of the most nerve-dense areas of the human body just sounds incredibly invasive,
It is.
which makes the idea of pain management pretty critical, I'd imagine.
It is literally the most critical part of the entire procedure.
Okay, so back to the San Diego clinic.
Right. So Dr. Haddad needed to practice this newly learned injection technique. She asked a few of her own employees, including Jamie, to be like models for the procedure.
Wow. Her own staff.
Yeah. And the promise made to Jamie was that it would improve her sensitivity and deliver those incredible orgasms we mentioned at the start.
And Jamie trusts her boss, obviously.
Exactly. She trusts the medical director of her workplace, so she agrees. But the execution of the procedure was just an absolute nightmare.
The details from the courtroom reporting on this are, honestly, they're just brutal to read.
They really are. According to the sworn testimony, Dr. Haddad used liquid lidocaine to numb the area before the injection.
Which is pretty standard, right? A local anesthetic?
Standard, yes. But the catastrophic problem was that the lidocaine she used had actually expired 3 years prior.
3 years? Oh my God.
Yeah, it provided absolutely zero numbing effect. None. So Dr. Haddad injected the plasma directly into Jamie's nerve-rich clitoris while she was fully capable of feeling every single microscopic movement of that needle.
I can't even imagine. Jamie actually described it on the stand as the most excruciating pain of her entire life.
Yeah, she was in such agony that she literally passed out on the floor of the treatment room.
Jesus.
And it gets worse. A co-worker testified that Jamie actually appeared to suffer a seizure from the sheer shock to her system.
That is just horrifying. And the long-term aftermath was completely devastating, wasn't it?
Completely. Instead of improved sexual function, the trauma resulted in severe, persistent vaginal numbness.
The exact opposite of what they promised.
Right. She testified that she could not even stand to be touched. And that utter lack of intimacy, combined with the psychological toll, it actually destroyed her 8-year relationship with the father of her child.
And a jury eventually awarded her $800,000, finding the clinic guilty of medical negligence and medical battery.
They did, yeah.
Though, I mean, we should note for context, California has this specific state law called mine res. It places a hard cap on non-economic damages in malpractice suits.
Right, things like pain and suffering.
Exactly. Because of that micro cap, the jury's award was forcibly reduced by the judge to $250,000.
Which is just a gut punch after all that.
Right. But honestly, the financial payout isn't even the wildest part of the story. The part that really brings us to the core of our deep dive today is the actual timeline of the paperwork.
Oh, this is the part that is just legally mind-boggling.
Tell them about the firing.
So, Jamie alleged in her lawsuit that she was actually fired from the spa weeks after the incident. And she claimed the firing was in direct retaliation for her refusing to sign a consent form.
A consent form that she was handed after the procedure?
Yes. The clinic only asked her to sign this form weeks after the botched procedure had already taken place.
I mean, that sounds like they asked her to jump out of an airplane and only tried to hand her the parachute disclaimer after she already hit the ground.
That is exactly what it's like.
You literally cannot consent to a risk once the damage is already permanently done to your body.
It completely invalidates the entire concept of informed consent.
But looking at the sources we have, let's play devil's advocate. If she had been handed that paperwork beforehand, what exactly would she have been consenting to?
Wrong.
Because clearly the verbal marketing pitch of better orgasms does not match the reality of what went down in that room.
This raises an important question, and it completely shifts how we need to look at this whole industry.
How so?
Because if you bypass the marketing brochures, right, and look at the actual paperwork clinics use, the fine print of the consent forms, it reveals this massive, frankly alarming gap.
Between what they say and what's on paper.
Exactly. Between what patients are told verbally and what is documented medically.
We actually have copies of real OSHA consent forms in our source stack today.
We do, yeah.
We are looking at forms from clinics like Physicians Ageless Solutions and Deborah Wilson, MD. And I gotta say, the lists of risks on these forms are not just your standard medical boilerplate.
No, they are staggering. When you read the fine print, the physical risks explicitly laid out include urethral injury, hematoma, urinary retention, severe yeast infections.
Wait, there's more, right?
Oh, yeah. Local tissue infarction, which is literally the medical term for tissue death and dyspareunia, which means chronically painful intercourse.
Tissue death. Just Wow. And those are just the physical structural risks, right?
Yeah, it's just the structural stuff.
Because the psychological and functional risks they list on the very same forms are almost bizarre.
They really are contradictory.
The paperwork literally asks patients to consent to the risk of constant awareness of the G-spot or like a sensation of always being sexually aroused or constant vaginal wetness.
And right next to those hyperarousal risks, the exact same forms list the risk of no effect at all.
Or worse.
Right. Or sexual function alteration, which could mean total numbness. Like what happened to Jamie?
It is a scattershot of literally every conceivable negative outcome, ranging from permanent loss of sensation to constant uncomfortable hyperarousal, all the way to literal tissue death.
Yeah.
Why would a clinic put such wildly contradictory outcomes on a single piece of paper?
Well, it's a kitchen sink legal strategy.
Ah.
The goal of a form like that isn't actually to educate the patient. It's strictly to create this impenetrable legal shield for the clinic.
Cover all their bases.
Exactly. By listing every single thing that could possibly go wrong, no matter how contradictory, the clinic can point to the signature later and say, hey, we warned you.
What really jumps out at me is this specific, very bold line on the physician's ageless solutions form.
Oh, I know the one you mean.
It explicitly states that the doctor assumes no responsibility for failure to achieve a desired result.
Yeah.
I mean, that is a completely different universe than the verbal promises of life-changing sexual enhancement that patients are given to get them into the chair in the first place.
Right. And in medical ethics, this dynamic is the textbook definition of information asymmetry.
Information asymmetry.
Yeah. For shared decision-making to be truly ethical, there can be no asymmetry of information between the doctor and the patient.
Meaning they both need all the facts.
Exactly. The physician cannot hold all the cards, while the patient is forced to make this life-altering decision based on an incomplete or like overly optimistic deck.
That makes total sense.
When a provider verbally hypes a procedure as a miracle, but legally shields themselves with a form listing 64 terrifying risks, they are ruthlessly exploiting that asymmetry.
They're using the glossy marketing to drive the sale and the terrifying fine print to dodge the liability.
Spot on.
But here's where it gets really interesting, though.
Okay.
If a procedure carries the risk of tissue necrosis and urethral injury and has 64 distinct documented risks attached to it, how is it even allowed to be performed in a strip mall medical spa?
Right.
Like, if this isn't FDA approved for this specific use, how does the broader medical community classify what is actually happening here?
That is exactly where we have to look at the ethical governing bodies.
Okay, let's look at them.
I want you to imagine moving from that chaotic spa treatment room into like a quiet wood-paneled medical library where the traditional rules of medicine are debated.
Setting the scene again. I like it.
We are looking at the AMA's Council on Ethical and Judicial Affairs, often referred to as CEJA.
TEJ, right.
Their extensive report on ethically sound innovation in medical practice shows that treatments like the O-shot exist in this very blurry, largely unregulated gray area.
It's not standard care, but it's not a clinical trial either.
Exactly. It falls into a category called innovative medical therapy. It sits on the continuum somewhere between an established, heavily vetted standard practice and formal, rigorously regulated scientific research.
It really is the Wild West of medicine.
It truly is.
I mean, during the San Diego trial, Dr. James Tappan, who is a veteran OBGYN acting as an expert witness, he testified that the O-shot is not a recognized and accepted modality.
Yeah, his testimony was pretty damning.
He even pointed out that the official-looking training certificate Dr. Haddad received from the O-shot's inventor is just a, quote, piece of paper not recognized by any national body.
Right. Because it is not a formal clinical trial, it doesn't have the strict oversight of an institutional review board looking out for patient safety.
But at the same time, because it is also not an established standard of care, it lacks the decades of safety data that come with routine procedures.
Exactly. So the CEJA and the American College of Physicians dictate that this kind of innovation requires very specific, heightened ethical duties from the physician to bridge that gap.
So if there is no official FDA oversight for this specific application, the burden of safety falls entirely on the individual doctor's ethical compass.
100%.
What does that actually require them to do, practically speaking, when they are standing face-to-face with a patient?
It requires radical, honestly uncomfortable transparency.
Radical transparency.
Yeah. The ethics manuals state that a physician must explicitly disclose how the treatment differs from standard therapy. They must reveal their own personal level of experience with the procedure, including if they have literally never done it before.
Which Haddad definitely should have done.
And, crucially, they must admit to the patient that there are unknown risks.
Hmm.
They have to look the patient in the eye and say, because this is innovative and unproven, there are things that could go wrong to your body that we don't even have the data to predict yet.
But wait, look at this from the doctor's perspective for a second.
Okay.
If you sit a patient down and hand them a piece of paper listing 64 terrifying outcomes, including tissue death and constant G-spot awareness, you're going to scare them right out of the waiting room.
You probably are, yeah.
So if a doctor genuinely believes their innovative technique will help a patient who's struggling with severe intimacy issues, is it really ethical to terrorize that patient over a worst-case scenario that might have a, 1 in a million chance of happening?
That's a classic argument.
Right. Doesn't ethical guidance allow doctors to hold back a little bit of information just to protect the patient's hope and ensure they get the treatment?
That is a very common defense used historically in medicine, absolutely. But modern ethics strongly shoots it down.
Really?
Yeah. Our sources include a fascinating comprehensive review published in the NIH's Digital Archive on avoiding deception and non-disclosure in clinical practice.
Okay, what does it say?
It addresses this exact concept, which the medical community calls therapeutic privilege.
Therapeutic privilege, meaning the doctor has the innate privilege to withhold medical information for the patient's own good.
Precisely. It is this outdated idea that a doctor can intentionally withhold relevant health information if they genuinely believe full disclosure would cause severe emotional distress or cause the patient to refuse necessary life-saving treatment.
Huh. But the NIH says no.
The NIH Archive Review makes it very clear that while therapeutic privilege technically exists as a historical concept, it is incredibly rare and almost never justified in modern practice.
Why is the medical community so against it now? I mean, it sounds like it comes from a good place.
Because it is fundamentally paternalistic.
Ah,
It assumes the doctor, as the ultimate authority, knows better than the patient about what the patient can handle emotionally.
which takes away the patient's agency.
Completely. The review stresses that withholding information to maintain false hope or just to avoid scaring the patient directly violates the core principle of patient autonomy.
Because without all the facts, even the really scary ones, informed consent is completely invalidated.
Right. You cannot make an autonomous free will choice about your own body if someone is intentionally hiding the reality of the risks from you, no matter how well-intentioned they claim to be.
And let's be real, in the case of elective, highly profitable procedures like the O-shot, it is rarely about protecting a patient from despair over a terminal illness.
Definitely not.
It is usually about making sure the patient goes through with the financial transaction.
Exactly. It's about making the sale.
Which naturally brings us from the doctor's ethical duty inside the exam room, out to the waiting room, and into the actual advertising that gets patients there in the first place.
Because advertising is the engine driving this entire industry.
So how do consumer protection laws clash with these exaggerated medical claims?
Well, the AMA guidelines clearly state that advertising should never create unjustified medical expectations
Okay.
or imply a certainty of result.
Certainty, that's a strong word.
That concept of certainty is vital to understanding the psychology here. We have research from Cardozo Law warning specifically against creating a myth of certainty in medicine.
Because bodies are unpredictable.
Exactly. Medical evidence is, by its very nature, inherently uncertain. Human bodies just react differently.
So when an advertisement promises a guaranteed outcome, like guaranteed orgasms or a 100% cure rate for dysfunction, it exploits a patient's natural vulnerability.
Yeah, patients want certainty, especially when they are dealing with highly sensitive, intimate health issues. And marketers know exactly how to leverage that desire.
Think about the last time you were scrolling through Instagram or Facebook and you saw an ad for a local wellness clinic.
Right, they're everywhere.
If you see a doctor in a white coat or a lot of clinical-looking graphs, you naturally assume what they are selling is an established medical fact.
Subconsciously, yeah.
So how does the Federal Trade Commission handle this? Because the FTC is the body that regulates truth in advertising.
Right, so the FTC's Health Products Compliance Guidance requires that any health-related claim be backed by, quote, competent and reliable scientific evidence.
Okay.
You cannot just say a treatment works because you think it does or because it worked once. You have to have objective, verifiable data to prove it to a reasonable consumer.
The FTC guidance actually gives some really specific, fascinating examples of what counts as deceptive in this space.
Yeah, it's not just about the words you use.
Right. It is heavily about the imagery. They point out that using fake medical imagery on a website, like putting your spa staff in lab coats or using the Caduceus symbol, that traditional medical staff with the snakes intertwined.
The classic doctor logo.
Exactly. If you do that without actual clinical proof for your product, the imagery itself is inherently deceptive.
Because it implies a level of scientific backing and institutional safety that simply does not exist.
Right. The imagery sets a subconscious expectation of medical authority in the patient's mind before they ever read a single word of the ad.
And the FTC also takes a very hard, uncompromising line on the fine print.
Oh, you mean the disclaimers that are always buried at the very bottom of the page?
Yes. Clinics often think they can make a wild, completely unsubstantiated claim in bold letters at the top of a webpage.
Yeah, cure your issues today.
Exactly. And then they try to protect themselves from the FTC by hiding a disclaimer in the tiny font of the terms and conditions at the bottom.
But that doesn't fly.
No, the FTC explicitly states that a fine print disclaimer does not legally negate a contradictory claim made in the main ad.
Oh, wow.
Yeah, if your billboard says 100% cure for urinary incontinence, a tiny font at the bottom saying results not typical or no clinical studies performed does not save you from a deceptive advertising charge.
Because the primary ad is still a lie. So, ethically and legally, it's basically like selling a lottery ticket, calling it a guaranteed retirement plan in huge neon letters, and then burying a sticky note on the back saying, you probably won't win.
That's a perfect analogy.
The fine print doesn't magically make the giant billboard ethical. It does not erase the deception that got the consumer to buy the ticket in the first place.
Right. And if we connect this to the bigger picture, it shows how the safeguards of informed consent are actually supposed to work in an interlocking system.
How so?
Well, the FTC rules are the outer wall, right? They're there to prevent the patient from being lured into the clinic under false pretenses.
Okay, yeah.
And then the medical ethics rules from the AMA and the ACP, those are the inner wall. They're there to ensure that once the patient is actually in the room, the doctor provides a brutally honest assessment of the risks, especially for something innovative and unproven.
But when both of those walls collapse simultaneously, you get tragic cases like Har-Hue.
Exactly.
It is a perfect storm of systemic failure. Like, the marketing lured patients with the myth of certainty.
Right. And then the doctor failed to disclose her lack of experience or the fact that the procedure was not a recognized standard of care.
And then the clinic attempted to use that terrifyingly detailed consent form, not as an instrument of shared decision-making.
But as a retroactive legal shield after the damage was already done.
Yep. And they did it all using an expired anesthetic.
It's just unbelievable.
It is a catastrophic breakdown of both the physician's fundamental duty of non-maleficence, to do no harm, and the patient's absolute right to bodily autonomy.
So what does this all mean? The Oshot case in San Diego really is a masterclass in what happens when the line between medical care and a commercial spa treatment is completely erased.
Absolutely.
We have learned that true informed consent, the kind that actually protects patients, it requires complete transparency about risks.
Radical honesty.
Radical honesty about the unproven nature of innovative therapies, and an absolute rejection of exaggerated marketing claims that create a dangerous myth of certainty.
Yeah, that's the core of it. So next time you are scrolling online and you see a flashy ad for a medical spa promising instant, life-changing physical results, ask yourself, are they treating you as a patient to be healed or just a consumer to be sold?
It's a vital question. Because as regenerative medicine, things like PRP and stem cell injections, as that continues to explode in popularity within these strip mall wellness spas, we are left with a pretty critical question to consider.
Which is?
Will traditional medical ethics, which were largely written for hospital settings and primary care doctors, be enough to protect patients in this heavily commercialized new environment? Or are we entering a new era where our intimate health is entirely at the mercy of consumer marketing laws rather than the Hippocratic Oath?